Hello, this is Jacqueline Eckern with Eating Disorder Hope, and I am privileged today to interview Camille Williams, a therapist with Timberline Knolls Treatment Center. With that, I'd like to introduce you, Camille, and have you tell us about yourself.
Hi, everyone. I'm so grateful to be here. My name is Camille. I'm a therapist at Timberline Knolls. I facilitate a lot of our eating disorder groups on campus, including self-image, body image, eating disorder education and process groups. And then I also work with individual clients, meeting their individual treatment goals, working with families, and just supporting a lot of our eating disorder residents on campus. I've also worked to kind of create some curriculum around eating disorder programming, and have always enjoyed opportunities like this to spread awareness and education about eating disorders, because it is not something that is widely known. I think people who are struggling with eating disorders are, informed and aware. However, it is the general public that can really benefit from additional information and support. So that is why I really am so grateful to have this opportunity to speak with you today.
Thank you, Camille. So we're doing this in honor of National Eating Disorder Awareness Week, which is February 22nd through February 28th. This happens every year. And Camille, we would love to hear your thoughts about why National Eating Disorder Awareness Week is important and how you plan to be involved, or TK how it plans to be involved.
Absolutely. I just think this week is incredibly important. The week itself, and then I know NEDA does a lot in terms of walks. So that is another way that NEDA really works to spread awareness. And I think anything that can get information out about eating disorders, NEDA's website has a lot of information. And I know for me, that is a resource that I go to often to help my clients or the families that I'm working with, or just, again, the public in general, to understand what eating disorders are all about, and specific struggles that people have in terms of body image and the relationship with food, and beyond that, looking at the emotional component and piece of it too. So there's so many parts to an eating disorder. And NEDA does a great job of trying to support those who are struggling, support, their families and loved ones who are trying to help them in their recovery journey, as well as just educate and inform, so that there is awareness out there. So that is why the week is really important to me. And I always hope to spread awareness beyond just that week. It's something I hope to do, every day. That's a really important value of mine. And then at TK, we often utilize the week as a time to really, educate our campus as well. So we often have different activities, awareness groups. We post things around our campus. We often have special programming throughout the week for our eating disorder groups. But it's also an opportunity, again, because we're talking about this stuff in our eating disorder groups all year round, all the time. So it's sometimes, residents that we see at Timberline Knolls who aren't there for an eating disorder, that this week can really benefit them in understanding more about eating disorders and how it might be similar to other addictions, or how it crosses over to, mood disorders and other things that people are struggling with. As well as just understanding how nutrition plays a role in wellness in general, which is probably something we'll be talking a little bit more about today.
Yes, excellent. Thank you for sharing what NEDA is about and NEDA Week, and just the insights about what you do every day to spread awareness. I think we can all do that. So with that, our topic in honor of National Eating Disorder Awareness Week today is health at every size. Camille is an expert on this topic, and we would love to hear your take on that. Can you just first start out sharing why we need health at every size, why that isn't just intuitively known by everyone?
Absolutely. Yeah. So Unfortunately, there are a lot of messages about health that are really not helpful. And one of the main messages that we see is that you can determine somebody's health by looking at them. So, health at every size is really necessary because it is working to challenge this belief and to begin to see that health, you cannot look at somebody and determine whether they are healthy or whether they are unhealthy. So, health at every size is really going to help us to look at health in terms of somebody's habits. And I think that's really crucial to begin to move away from being able to assess somebody's health by looking at them and instead starting to get to know more about the person and what their life looks like in order to figure out what health looks like and to know that health is very individualized. So, it's not going to work, as a therapist. I'm not going to make the same recommendations for every single one of my clients. I'm going to look at the person as an individual and see what their individual needs are and what wellness looks like for them. So it can't just be a one size fits all prescription in terms of health or wellness.
So can you maybe discuss health at every size as it applies to anorexia, bulimia, and binge eating disorder, just to take a few eating disorders out of the picture and break it down?
Absolutely. Yeah. So, health at every size. I mean, so looking at eating disorders in general, health at every size also, just like we can't assess health based on the way somebody looks, we also cannot determine whether or not somebody has an eating disorder based on the way they look. Again, we need to know what their relationship with food looks like. And so there are a lot of assumptions that people make about people's bodies. So if somebody is in a smaller body, there may be assumptions that, oh, this person isn't eating, is this person anorexic? And again, I cannot determine that by looking at somebody's body. So there can often be, criticism, judgment, or praise for somebody who is in a smaller body. And anorexia can sometimes almost be a glorified word of, oh, like, look, it looks like she's anorexic. That can be used in a negative or positive light, which again is really unfortunate that by looking at somebody's body, assessing them as anorexic or not based on how they look, really again tells me nothing about what this person's life is like currently. And that's really what's most important. And then when it comes to bulimia, um, again, we have no idea based on somebody's body if they are struggling with an eating disorder. So, somebody who is bulimic could be in a smaller or larger body. And so, oftentimes, somebody who's struggling with bulimia may feel that they are not thin enough to have an eating disorder or not sick enough, or it's okay for me to continue using my behaviors because. Because of my body. Like maybe I'm at a normal BMI. And so then I can keep doing what I'm doing because clearly it's not a problem. So again, it's so many assumptions that the body is telling the person that what they're doing is okay or that they're not sick enough. So all of these messages come just from the body. And then when we look at somebody who's struggling with binge eating disorder, this is a population in specific that's really important to me because I find that this eating disorder will, first off, it is more prevalent than anorexia and bulimia combined. However, often not talked about, not portrayed in the media. So, really does not get the support and attention that it needs. But also, there tends to be so much more stigma and judgment when it comes to binge eating. So, that is when a lot of the criticism of, oh, well, if somebody's in a larger body, well, they just need to eat less and what's wrong with them? They're just fat and lazy. So all of these really judgmental words that, again, we do not know any of that. I do not know how hardworking somebody is by looking at their body. That literally tells me nothing about a person's characteristics, let alone their relationship with food. I do not know anything about somebody just by looking at their body. I really need to get to know the person. So the binge eating population in particular tends to be, very criticized and stigmatized when it comes to eating disorders. So health at every size is really important for those who are struggling with eating disorder behaviors and are in a larger body, and may be subject to more criticism, more judgment, um, and more stigma. And unfortunately, that does make it harder for that population to get support, because having that judgment, having that stigma leads to a lot more internalized shame. And if I am believing that there's something inherently wrong with me, that I'm just lazy, then I'm probably going to try to figure out recovery on my own. And that's really challenging. Eating disorder recovery takes a whole team, a dietitian, a therapist, a medical doctor, support groups. I mean, and probably many more that I'm leaving off. Those are just kind of the primary people that are necessary. Um, all to support this individual. And so if I feel like I have to take that responsibility on all myself, it's probably not going to go too well.
So I know you are lead a ton of groups at Timberline Knolls and really hear people at all levels of just facing up to having an eating disorder to relapse. Can you talk about their struggles with body image, weight, and how adopting a health at every size perspective could be helpful to them?
Absolutely. Yeah. So I mean, the body image piece, is really tricky in recovery, and especially for those that I work with at Timberline Knolls, since I am in the residential setting. Eating disorder behaviors are usually pretty severe. So we're usually just making some small and slow progress when it comes to body image. However, I think what's really significant when it comes to health at every size is being able to have an intention that aligns with recovery values. And so that's, I think, so health at every size, I think, can provide a foundation for what is my purpose for creating change. And in my eating disorder, have I been focusing on the number on the scale, or the way my body looks, or the way a certain part of my body looks? And has that not really worked out so well for me? Has that kind of kept me stuck in this loop of eating disorder behaviors, or being really unhealthy in other areas of my life? So maybe like my social life has fallen apart, or maybe my career goals have really been halted because I've been so preoccupied at the gym or with behaviors that I'm engaging in. So that's kind of taken over my life. So being able to use health at every size as a foundation to say, hey, I want to focus on what my health can look like. So maybe that means, rather than focusing on the way my body looks, I'm going to start to think about how I feel moving in my body. Or am I going to have an intention be to appreciate what my body can do? So rather than caring, what my arms look like, am I grateful that I have arms so I can hug the people that I love? So seeing that mindset shift can be really helpful. And so with HAZE, or with health at every size, just creating, what is my intention? What goals do I have? How can I care for myself? Probably one of my I don't know if I want to call it a favorite, but possibly a favorite experience, or just a really impactful one for me, that I really saw health at every size, at work, and just, yeah, incredibly powerful, was working with an individual who finally found a medication for her depression that was actually effective. However, she did gain a little extra weight while in treatment, and she really struggled with that. The psychiatrist let her know, like, ultimately it's your decision what meds you want to be on. However, if this is the most effective medication for your depression, like, maybe that's something to really consider, even though, of course, your eating disorder is not happy that there are other antidepressants that you've been on that haven't resulted in a little bit extra weight gain. So probably for a month, maybe 2 months, she processed it in groups, talked about it in individual sessions, and ultimately determined that, yeah, her mood was better than it had ever been. And so that was kind of, a way to tell her eating disorder, no, you're not going to win. I care more about my overall health than I do the way my body looks. And so that was so cool to me, and really just reflects what Health at Every Size is all about, that I'm going to look at my overall wellness. Because if I'm so depressed that I can't get out of bed and I can't eat, then I am not going to be a healthy, functioning person having a meaningful life. So if taking a medication that, changes my body, maybe in a way that I don't love, um, can I focus more on loving my life than having the ideal body that I would like to have?
Excellent. Thank you. And how about for parents watching, coaches, people that have influence on young people and adolescents, even into their early 20s? What kind of messaging can we be giving them to help support a healthy perspective about their body, not measuring it as a weight or a billboard for society to look at?
Absolutely. I have been really into the, functionality piece when it comes to body image. So really focusing on what our bodies can do. So I think especially for coaches, like in order to, be in sports and be athletic, the body is doing so much to support those types of things. So there's a lot that coaches can focus on in terms of like, wow, look how impressive and amazing the body is. And I think it can be helpful for parents to do that too, and even beginning to appreciate their own bodies in that way rather than be appearance focused. I know when I first started at Timberline Knolls, I was still, more into how do we transform negative body image thoughts into positive ones. So, can we, instead find features of our body that we do like? And I've kind of moved more away from that. I think it can still be helpful if it works for somebody, awesome. But really, I think the functionality piece tends to work a little bit better, because maybe I'm not going to love every part of my body, and that's okay, because I can still appreciate, what a part of my body that I don't love the appearance of it can do for me. So that's kind of my approach that I always recommend. And I think it can be helpful for parents and coaches, or really anybody who is, working with individuals who have eating disorders, or anybody in general, because body image really applies beyond eating disorders, is just to focus on what's underneath. So if somebody is expressing body image concerns, there's probably something else emotional going on. From what I see a lot of times when somebody is wanting to change their body, it's more about wanting to be accepted, wanting to fit in, wanting to belong, wanting to feel good enough. So, really getting at some of those core emotional needs, that's probably what's underneath the body image. And unfortunately, people find that out. I mean, it can be years and years before somebody really realizes, like, oh, I've been trying to lose weight so that people will love me, or people will accept me, or so that I will accept me. When really that, changing your body is never going to take you there. I often say you can't solve an internal problem with an external solution. So losing weight is not going to fix internally what I'm struggling with. I have to do that work internally as well. So I have to really look at how can I accept me for me, regardless of what my body looks like or changes that I make to my body.
So well said. Thank you for sharing that. And what it brought to mind for me is the media. So we, for many years, have been bashing the media, and in some cases, rightly so, right? Because there's been a promotion of a certain body type. How can you talk about the media, health at every size, and then also touch on what we can do to be a positive influencer in the world about accepting and loving our bodies and teaching others to, similar to the health at every size movement?
Yeah, absolutely. I mean, I think the one really great thing about the media is that there is so much out there. And so actually, I have found that in some of the social media that I use, I have really combed through and been very specific about what I allow on my pages. And so I feel like I have so much like eating disorder support, and things that align with my values and what I practice and preach. So I actually don't feel like I have that much negative influence on my social media. So that's one recommendation that I do have is, if you're looking and scrolling through social media and things are standing out that are making you feel less than or not good enough, maybe it's time to get rid of some of that stuff. So I think that can be really helpful because, of course, there is a lot of that that's still out, in the media. So really monitoring and censoring what you're allowing, into your own life, I think is really important. Because it can be really detrimental if I'm, looking at people who are really focused on weight loss or images of, models or people who are photoshopping themselves, that is going to influence what I think I should look like or what should be important in my life. And not wanting the media to determine that for me. I want to decide for myself what's most important. And I think that's a part of health at every size too, is beginning just to identify like, what does wellness look like for me? What does health look like for me? What are my values? And because again, as a therapist, I don't know the correct answers for each person that I'm working with. My goal is just to help them figure out what's most important to them, not what's most important to, their, social media, not what's most important to their significant other, what's truly most important to them.
Absolutely. Thank you for sharing on health at every size. Before we go, can you just tell us a little bit about Timberline Knolls and what is offered and what treatment levels and where you're located, that sort of thing?
Absolutely. So Timberline Knolls is located in Lamont, Illinois. That is maybe 40 minutes outside of Chicago, not too far. And that is where our residential location is. And we treat adolescents and adults, so all ages. And we also have a partial hospitalization program that is located just a little bit, probably 15 minutes away from our residential location. And we work with, really most diagnoses, mood disorders, addictions, substance use, eating disorders, personality disorders. And we offer, all sorts of groups. Our primary focus is dialectical behavioral therapy, with acceptance and commitment therapy in there as well. And then that is really well balanced with our expressive therapies. So we have art therapy, dance movement therapy, yoga, which I think, works well to have kind of the concrete DBT skills that are being learned paired with the expressive therapy, especially in eating disorder recovery. Having that mind, body, soul connection, is so important. And that's probably not going to happen sitting in a therapy room. That's probably going to happen when you're moving your body in dance movement therapy or when you're connecting through art. So doing more of those expressive therapies can really help with a holistic connection. So that is one of the things that I really love about Timberline Knolls, is just the many different approaches that we offer. Yeah. Any other questions about Timberline Knolls?
I think we would also like to know the best number to call for Timberline Knolls. And I can give that if you don't have it available.
Yeah, I do not have it on me.
Okay, it's super important. So let me just pull that up right now.
Perfect. Thank you.
And when somebody calls while I'm pulling that up, can you tell us what they will expect to find in terms of helping them sort through how to get treatment, what level of care, how to deal with insurance?
Yeah, so our admissions team will probably do, an assessment over the phone to help, have an idea. I think over the phone they still can't fully assess, so they might make a recommendation that, oh, it sounds like based on your struggles, you might be a good fit for residential or partial. But ultimately, when somebody, gets to our welcome center and has an in-person assessment, that's kind of when the final determination will be made. Sometimes that's determined by insurance. So I know we also have a utilization management team that looks at, insurance coverage. And so sometimes insurance will also have a recommendation that based on somebody's struggles and where they're at with behaviors, they might be a better fit for residential or partial hospitalization.
Got it. Okay, that sounds really helpful. Like if you getting on the phone and calling probably makes a big difference to just moving forward. Even if you're not ready to make that decision yet, you could at least find out what is necessary to seek treatment. And the phone number is 888-206-1175. And the website is timberlineknolls.com. And with that, I'd just like to thank you for this interview and your time today. If anyone wants to reach Camille, you can certainly call and leave a message at, at the number provided. And we appreciate your time today. Thank you.
Thank you.